Good afternoon. There's a medical revolution happening all around us, and it's one that's going to help us conquer some of society's most dreaded conditions, including cancer. And the revolution is called angiogenesis, and it's based on the process that our bodies use to grow blood vessels. In total, there are more than 70 major diseases affecting more than 1 billion people worldwide that all look on the surface to be different from one another, but all actually share abnormal angiogenesis as their common denominator. And this realization is allowing us to reconceptualize the way that we actually approach these diseases by controlling angiogenesis. Now, I'm going to focus on cancer because angiogenesis is a hallmark of cancer, every type of cancer. So here we go. Start out as small, microscopic nests of cells that can only grow to 1/2 a cubic millimeter in size. That's the tip of a ballpoint pen. Then they can't get any larger because they don't have a blood supply, so they don't have enough oxygen or nutrients. And in fact, we're probably forming these microscopic cancers all the time in our body. Autopsy studies from people who died in car accidents have shown that about 40% of women between the ages of 40 and 50 actually have microscopic cancers in their breasts. About 50% of men in their 50s and 60s have microscopic prostate cancers. And virtually 100% of us, by the time we reach our 70s, will have microscopic cancers growing in our thyroid. Yet without a blood supply, most of these cancers will never become dangerous. Dr. Judah Folkman, who was my mentor and who was the pioneer of the angiogenesis field, once called this cancer without disease. So the body's ability to balance angiogenesis, when it's working properly, prevents blood vessels from feeding cancers. And this turns out to be one of our most important defense mechanisms against cancer. In fact, if you actually block angiogenesis and prevent blood vessels from ever reaching cancer cells, tumors simply can't grow up. But once angiogenesis occurs, cancers can grow exponentially. And this is actually how a cancer goes from being harmless to deadly. Cancer cells mutate, and they gain the ability to release lots of those angiogenic factors, natural fertilizer, that tip the balance in favor of blood vessels invading the cancer. And once those vessels invade the cancer, it can expand, it can invade local tissues, and the same vessels that are feeding tumors allow cancer cells to exit into the circulation as metastases. And unfortunately, this late stage of cancer is the one at which it's most likely to be diagnosed, when angiogenesis is already turned on and cancer cells are growing like wild. So, if angiogenesis is a tipping point between a harmless cancer and a harmful one, then one major part of the angiogenesis revolution is a new approach to treating cancer by cutting off the blood supply. We call this anti-angiogenic therapy, and it's completely different from chemotherapy because it selectively aims at the blood vessels that are feeding the cancers. And in fact, when we give cancer patients anti-angiogenic therapy, here, an experimental drug for a glioma, which is a type of a brain tumor, you can see that there are dramatic changes that occur when the tumor is being starved. Here's a woman with a breast cancer being treated with the anti-angiogenic drug called Avastin, which is FDA approved. And you can see that the halo of blood flow disappears after treatment. In other words, can we eat to starve cancer? Well, the answer is yes, and I'm going to show you how. And our search for this has taken us to the market, the farm, and to the spice cabinet, because what we've discovered is that Mother Nature has laced a large number of foods and beverages and herbs with naturally occurring inhibitors of angiogenesis. So here's a test system we developed. At the center is a ring from which hundreds of blood vessels are growing out in a starburst fashion. And we can use this system to test dietary factors at concentrations that are attainable by eating. So let me show you what happens when we put in an extract from red grapes. The active ingredient is resveratrol. It's also found in red wine. This inhibits abnormal angiogenesis by 60%. And here is a growing list of our anti-angiogenic foods and beverages that we're interested in studying. And for each food type, we believe that there's different potencies within different strains and varietals.